Hi, my name is David Martens. I'm the Clinical Manager of Cardiac Rehabilitation at Doylestown Hospital. Today's talk is on exercise guidelines and exercise methods proven to work. There are two key elements for today's talk. First, to exercise on a daily basis, and second, to use today's information to maximize your success. Topics for today: how to get started, what's the best location for exercise, components of exercise, how to exercise, how much exercise, how to review and adjust your exercise program, the benefits of exercise right from the start, and safety. First, we stress test our cardiac rehabilitation patients. This helps determine the patient's initial target heart rate range, initial speeds and grades. It also projects goals for intensities in 30 days and 12 weeks. Every 30 days, you will be reassessed on your progress. We measure how many minutes you have added to each session, as well as minutes per week. We will also assess your fitness improvement by looking at increases to your MET level, watts, top speeds, and levels of resistance. Use the back of your exercise log as a guide for your progress. Fitness outcomes. Our cardiac rehabilitation stress test and exercise prescription method produces a superior fitness improvement compared to the standard method of many other cardiac rehabilitation programs, which only use a 6-minute walk test. According to the National Database of the American Association of Cardiovascular and Pulmonary Rehabilitation, Doylestown Hospital patients achieve the highest fitness ranking. Locations for exercise. Home. Many people that choose to exercise at home stop using their equipment. Negative factors with home exercise. Lacks motivation. It can be boring to exercise alone. Lack of space and selection of equipment. Lower quality of equipment. Positive factors with home exercise. Time efficient, no travel, and no competition for use of equipment. Gyms. Gyms provide a motivating environment. Seeing other people exercise is very motivating. Staying on one piece of equipment for 30 to 60 minutes can be boring to some patients. It's much less boring to exercise on 3 different pieces of aerobic equipment for 10 minutes each versus a 30-minute workout on one piece of equipment. Gyms offer high-quality equipment, a variety of classes, and some gyms offer aquatic programs. Personally, I think doing a combination of home exercise and going to the gym works the best. If you're short on time, exercise at home. If you lack motivation, go to the gym. If you're bored, try using different machines at the gym, or consider getting some personal trainer sessions, or take some classes. Building your home program. Our cardiac rehab team will work with you to individualize your exercise program. Every exercise program is built according to the patient's goals, interests, fitness level, cardiovascular status, orthopedic limitations, and many other health considerations. The purpose of resistance exercise is to improve muscular strength and endurance. It can also be good for your heart. If you minimize rest breaks in between the different exercises, you only need to work on strength training 2 to 3 times per week. The following components make up your aerobic exercise program: frequency, intensity, type of exercise, time, progression of exercise, and volume of exercise. Frequency. The best advice is to exercise daily. Eventually, it becomes a habit and your body will signal you to exercise. This advice will prevent you from backsliding into an insufficient amount of activity. We should at least exercise at a moderate intensity 5 times a week. Intensity of exercise. Our stress test endpoint of high, moderate to almost hard projects the patient's maximum heart rate and fitness level, which is measured by a MET number. The higher the MET number, the lower the risk. Patients with a max MET level greater than 7.9 are considered at lower risk for future events. We use the starting intensity of 40 to 59% of their maximum. When the patient has been inconsistent with exercising at the correct frequency or intensity. As the patient's fitness level improves, we progress the peak intensity to 60 to 80% of their maximum. We increase the intensity when the heart rate is not reaching the upper range. Another technique to improve fitness is high-intensity interval training. This technique is very effective at improving fitness levels. If you're interested in this technique, please discuss with our cardiac rehab staff. Every 30 days, a cardiac rehab therapist will evaluate and review your progress. We want you to occasionally assess your progress by looking at the back of your exercise log sheets. At the top of the sheet is your initial workout. Below that is the 30-day goal. Hopefully in 30 days you will be able to exercise for 3 to 5 minutes at 70 to 80% of your max MET level. Below the 30-day projection is our goal for you at the end of the program, using a percentage of your age predicted. Below the age predicted projections are the high-intensity interval settings. If you are not improving, high-intensity interval training may help you improve your fitness. Using age-predicted maximum heart rate. Age-predicted maximum heart rate is calculated by 220 minus your age. Example for a 65-year-old, 220 minus 65 equals a maximum heart rate of 155 beats per minute. There are problems using age-predicted max heart rates. Some patients have a low max heart rate for their age, and others have a higher than expected max heart rate. Another problem using age-predicted heart rates are beta blocker medications, which dramatically lower a person's exercise heart rate. Using a 6 to 20 exertion scale. It takes skill, practice, and experience to use an exertion scale. You need to learn how your body responds to exercise. I like to teach patients to notice how their breathing changes as the intensity increases. The greater the breathing increase, the higher the exertion number. Looking at our scale, the number 12 represents a moderate intensity, and there is a slight increase to breathing. The number 13 represents the point that the patient can clearly notice their breathing has increased. For example, when the patient is talking, they will have to take a deeper breath and may also need to breathe a little faster. The number 14 describes a slightly faster breathing rate and depth, but is still not heavy. The number 15 is when the patient's breathing is on the heavy side and carrying a conversation may be difficult or not possible. Intensity problem. Only 20% of the population likes exercising at hard intensities. As the intensity increases, the amount of displeasure increases. If the patient does not like the intensity, it should be lowered and reevaluated. The more you enjoy the workout, the more likely you will exercise for the rest of your life. Use of intensity during the exercise session. Warm-up intensity. The warm-up should feel light with very little change to your breathing and last for approximately 5 minutes. Exercise intensity. After the warm-up, increase the intensity to the desired range. Choosing one intensity level will limit your progress. We recommend using a range of intensities. For example, a patient warms up at 2.2 miles per hour, then increases to a faster speed and grade of 2.5 miles per hour on a 2% grade. And for the last 5 minutes, the patient increases to 2.8 miles an hour on a 3% grade, and then slows the treadmill with no grade for 1 to 2 minutes. Our method of exercise prescription gives our patients a huge advantage over most other programs. Our patients learn how to warm up, listen to their bodies, progress the exercise intensity, and learn more about their upper range. Exercising patients in the upper ranges, such as 70 to 80% intensity, offers more benefits than lower intensities of 40 to 60%. By using a range of lower and higher intensities, we provide a high enjoyment factor and better outcomes than the national average. Cool down intensity. The cool down is very important to maximize safety. During the cool down, the patient should learn to walk slowly, stretch, and drink water. Most patients should also consider adding balance exercises. The first goal is to get 30 minutes of aerobic exercise per day. You do not have to exercise for a straight 30 minutes. You could do 15 minutes in the morning and 15 minutes in the afternoon. The next goal is to increase time towards 60 minutes. The amount of time is going to vary from patient to patient, depending on age, arthritis, satisfaction, and many other factors. Research indicates that 150 aerobic minutes of exercise per week will help provide a good outcome in terms of lowering the rate of rehospitalization and mortality. Increasing above 150 minutes per week continues to improve the outcome up to 300 aerobic minutes per week. You can overtrain, such as a marathoner, and lose some of the benefits of exercise. Type of exercise. A common question I receive is, what's the best exercise? Our cardiac rehab staff have many things to consider: body type, arthritis, exercise history, joint injuries, enjoyment factor, balance, and many more. Running. Running is not for everyone. It causes people to breathe much faster and deeper, which may not be enjoyable. If your height-weight number is over a BMI of 24, there is a higher probability running may cause harm to your back, hips, knees, ankles, or feet. Our cardiac rehab program offers a new machine that mimics running perfectly and eliminates impact. So if your BMI number is over 24, you could try running using this machine. You could start by alternating back and forth with the treadmill and running machine using short intervals. Elliptical machines put you in a weight-bearing position, but eliminate impact and will enable you to exercise at higher intensities without causing joint damage. The elliptical machines we use in our program feel more natural than many other models. Not all elliptical machines are equal. Outdoor walking. There are pros and cons with outdoor walking. Weather can affect compliance and could cause harm, such as walking on a slippery or uneven surface. If the incline or grade is flat, the walk may not be sufficient enough to increase your heart rate. Treadmills have a smooth, even surface, easier to adjust speeds, and are more motivating at higher speeds and grades, and can provide moderate to steep inclines, which help improve aerobic fitness better than level walking. Walking at 4 miles an hour on a level surface increases the resting metabolism from 1 MET to 4 METs. Walking at 3.5 miles an hour on a 5% grade increases the metabolism to 6 METs, which is 50% higher than walking 4 miles an hour on a level surface. Measuring aerobic fitness. Aerobic fitness is assessed by your peak MET level. The endpoint on a treadmill test determines the peak MET value. 1 MET is the body's resting metabolic rate. At rest, the body uses 3.5 milliliters of oxygen per kilogram of body weight per minute. The harder the exercise, the more oxygen is used and the higher the MET level. Treadmill versus level walking. Exercising at higher MET levels offers our patients better outcomes. This slide shows the advantages of exercising on a treadmill with grades over walking without inclines. A 60-year-old male has an age predicted max MET level of 9. If the 60-year-old patient walks on a treadmill at 3.5 miles per hour on a 5% grade, they are exercising at 6.1 METs, which is 68% of their age predicted. The same patient walking at 3.5 miles an hour without an incline is exercising at 3.7 METs, which is 41% of their age predicted. Looking at a fast walking pace, a 60-year-old patient walking on a treadmill 4 miles an hour on a 5% grade is exercising at 6.8 METs, which is 76% of their age predicted. A patient walking 4 miles an hour without an incline is exercising at 4.1 METs, which is 45% of their age predicted. Biking. There are many ways to bike indoors. There's a standard upright bike, recumbent bike, and spin bike. Exercising with people is more fun, and spin classes are more fun than doing it alone. We often have our patients try different bikes and recommend using the bike they enjoyed the most. Outdoor bike riding is another fun option, but has many dangers such as flats, falls, bike crashes, and car accidents. Upright steppers are more vigorous exercise and seem to be the least used in gyms. Pros: offer a vigorous workout and no impact. Cons: the upright stepper may be too vigorous and patients with knee pain may not tolerate this type of exercise. Recumbent machines. There are many different recumbent machines that allow you to exercise in a seated position, such as the recumbent bike, recumbent stepper with upper body, and the arm bike machine. If you're deconditioned, it offers you a way to have a high-quality workout with minimal discomfort. Our staff will spend a lot of time with you making sure they have found the best seat settings. Rowing machines. Rowing machines are a great workout. They can be on the vigorous side if the pace exceeds 26 to 30 strokes per minute. Most of our patients like to use the rower for 5 to 10 minutes. Pros: works both upper and lower body, no impact, and offers a wide range of intensities. Cons: it may be too intense for some patients, requires a lot of knee bend, may aggravate back pain, and harder to lower yourself onto and off the rowing machine. Circuit weight training. There are many options to do circuit weight training, such as weight machines, free weights, calisthenics, or any combination. The key principle is to move from one exercise to the next with minimal rest, which keeps the heart rate elevated. Aquatic classes are a great tool to have if we cannot find a machine that works for our patients. The water supports you as well as soothes your joint pain. Aquatic classes are excellent for patients with severe arthritis or balance limitations. Arthritic patients report less pain and better range of motion after doing aquatics. There are many ways to get a great workout in the pool: swimming, aquatic classes, walking in the water, and many more. Balance training. As we age, we lose some of our balance. It can start to happen in our 50s and get more noticeable each decade. It's important to train for balance. The Cardiac Rehab Hallway has some examples of balance exercises, which could be added to your cooldown. Yoga and Tai Chi are other ways to improve your balance. Stretching. As we get older, we also lose flexibility. We recommend our patients use stretches that they have the ability to perform with minimal risk. You will be instructed to slowly move into the stretch and hold it for a count of 30 and then repeat. Most of our patients can do at least 5 stretches or range of motion exercises. After a few weeks, you can see an improvement to your range of motion. Evaluating your progress. The first sign of progress is increasing your aerobic minutes of exercise. Most patients are able to progress to 35 to 40 minutes of aerobic exercise per each cardiac rehab session and 30 minutes for their home workouts. The next goal is to progress the intensity. Most patients are able to progress their intensity by 2 METs, which requires a steeper walking grade and sometimes a faster walking speed. The same principles of higher resistance and faster speeds apply to the other equipment. Another way to see progress is looking at the volume of exercise, such as total minutes per week, calories expended per week, or steps per day. We recommend that you occasionally review your past exercise logs. Have you increased your aerobic minutes to at least 35 to 40 minutes per session? Have you increased your peak MET level by at least 1 MET? If you notice your progress is minimal, discuss your concerns with our staff. There are many different ways to improve your MET level and increase your endurance. Fitness trackers can also help you progress your fitness by providing daily and weekly feedback. Fitness trackers provide information on total steps, total distance, calories burned, weight change, and sleep. I have one, and it definitely motivates me to be more active. I have a specific activity goal each day. The more active I'm at work, the less exercise I need, and the less active at work, the more exercise I need that day. Immediate benefits of exercise. Within a few weeks, you will notice better blood pressure, less threatening irregular heartbeats, higher levels of serotonin, which lessens sadness, lower triglycerides, lower blood sugar levels, better blood flow, feel better, and more energetic. Safety. Stop exercise if you experience any of the following symptoms with exercise and call your doctor. If you cannot contact your doctor, call 911. Common cardiac symptoms. Location. It may be in your chest, neck, throat, jaw, teeth, shoulders, back, or arms. Intensity. It does not indicate the severity of the situation. A patient with mild symptoms could have severe 3-vessel disease, and another patient with severe symptoms may have single-vessel disease. Duration. Your doctor will ask, how long have you had these symptoms? How does it start? How does it last? How does it go away? Your doctor may also ask, have you noticed your usual activities are getting tougher? Do you fatigue much faster? Do you breathe much faster and deeper during moderate activities? These questions can help your doctor assess the situation. To summarize the main points, come to Cardiac Rehab Gym 3 times a week. Exercise in between gym sessions so that you're exercising most days of the week. Exercise minutes and intensity should increase every 1 to 2 weeks until you have reached your goals. Consider getting a fitness tracker to assess progress and achieve daily and weekly goals. Fitness trackers with heart rate monitor can also help guide intensity. If you're having problems sticking to your exercise program, discuss concerns with our staff. I would like to thank the Friends of the Heart for their financial support, which helps us purchase the very best exercise equipment to help our patients achieve outstanding results. Thank you for listening.